Okay, welcome back from break, everyone. 10:45-ish. We are picking up a little bit more work on H233, an act relating to the requirements for state-funded grants. We have with us Jesse Bridges, he's the CEO of United Way of Northwest Vermont. How you doing?
I'm good. Thanks for having me.
Of course. So, we are at a point right now where we're just like taking more feedback and input from entities that receive grant funding. And we were just hoping you could just speak to the system as you're observing it, from you and your organization's eyes and, perhaps others. And I guess we could just sort of start with that.
Great. I appreciate the opportunity to speak with you today. As mentioned, for the record, Jesse Bridges, I'm the CEO at the United Way of Northwest Vermont. Our United Way covers Grand Isle, Franklin, and Chittenden counties from a regional perspective. And then we run a couple programs that serve larger portions of the community. Our Working Bridges program, our prevention program, which I'll talk a little bit about today, serves our region in central Vermont. And then, of course, we run Common Good Vermont, which is a statewide program. I think like many organizations you've heard from, we receive funding from the state. A couple, I think, of distinct points about the way in which we receive funding that might differ from others. The funding currently that we're partnered on and we receive is not federal. So all the guidelines, the requirements, the compliance, the timelines are completely in the state's control. I also note that we receive this funding not simply to do work on behalf of the state. We do this in partnership, right? And I think most of the organizations that we partner with and we work with in the nonprofit sector do view it that way. That we're doing work together. It's our mutual goals to improve Vermonters' lives, and that is at the heart of what we're trying to do. And I think, one of the things that we can recognize as we enter an era of significant change that's coming to us, we really have to look at what do we have control over? What can we influence? And, I've been thinking about this a lot as many of my colleagues and I have grappled with our organization's different funding streams and which programs can stay or go in the light of the changes of federal funding or the insecurity over what's happening with regards to federal funding. We have an opportunity, and I think we should not waste the moment to really lean into thinking not just what we do with how much we fund, but what we do with how we fund. And really changing the dynamic in, again, what we have control over to allow organizations to do the work, the incredible work on the ground that's working in many corners of this state to make our communities healthier, to make our communities more robust, to improve the lives of Vermonters that are here now, and to improve the lives of all the new Vermonters that we need to have come here so that we can meet this moment. And so a lot of what's in H233 provides opportunity for us to both have a mechanism to improve how the state and nonprofits partner and how that funding flows. And again, how we do that work and how much time we spend doing reporting and reimbursements and other things. One of the things that I mentioned is the way in which we do our funding is slightly different for the program that I want to talk about is we partner with DSU, and we are the lead prevention organization for Northwest Vermont and for Central Vermont. And in that role, we convene prevention organizations around substance misuse that are doing incredible work, trying to help us stem the tide, help us move forward. We're never going to get ourselves out of a substance crisis that we're in if we don't turn off the spigot and really look to also thinking about the future. The funding that we receive is part of the retail cannabis funding that's provided dedicated funding for prevention every year, which is an incredible thing that the legislature did, and we're really grateful to the forethought of that as we moved into the retail marketplace. And that's providing some sustainability. It's providing some dedicated funding. But how we do that funding really matters. And one of the things that we've tried to do as a partner, we subgrant over 70% of that grant to our local partners. And in our role at United Way, we've tried to make that funding more accessible. In fact, in the first year of the grant, we actually extended the funding to organizations in advance and took on all of the financial risk and all of the delay in getting reimbursed on our organization. That, of course, then created some real complications for us and some cash flow issues for us as we waited to be reimbursed for significant expenses, over $500,000 in one invoice that we had to wait months for, which meant we had to dip into our reserves, which meant we lost money going down the road. And I think that that is a common story at all levels, maybe not always at that scale, but in the day-to-day for a small nonprofit, that can be the difference between making payroll. It can be the difference between having to take out an extremely expensive payday loan to make it work. And we are trying to think about ways in which we can find a reasonable path for organizations to have ways to not exist all the time in that reimbursement market. I think some of the other pieces in here that are really important are things like indirect rate, right? The ability to truly reflect what it costs to do that work. Remembering that indirect often is the cost to support the people doing the work. And the people doing the work are as important as the work itself. You probably heard this, but 1 in 5 Vermonters works for a nonprofit. Working Vermonters works for a nonprofit. That's 20% of the workforce. Those people are our community members and partners, and they deserve the supports and resources to do that work. So they deserve to have HR. They deserve to have benefits. And that's what's going to make our communities healthier. And so, while I think this bill has been something we've been talking about, and a lot of the tenets of this have been something we've been talking about for a few years now, I do think there is a sense of urgency that we need to start moving this conversation forward. I want to recognize the administration has made some updates to the bulletins, and we are, moved in the right direction in some places. But I think we have the opportunity to do so much more, while also thinking about just how it's not, again, just how much, it's how we do it. If we can make the funding more accessible, if we can change the way we exist as a partner at the state with nonprofits, we can make those dollars go a lot farther. Opportunity for questions too, if people would like.
Okay. So your particular organization, like what type of payment delay timelines are you experiencing? Like over the 30?
So, it depends on the time. I think it's both a delay oftentimes so payment reimbursement. The other piece of it is a delay in contract. So when we started that grant, we probably got 2 months into the grant before we actually got our contract. We invoiced for a quarter that ended in, the end of March, and didn't receive our payment until July, August timeline. So there are times where it's, there are significant delays, and remembering that if you're invoicing on 3 months of work and then it's taking 30 plus days, you're now, 4 months from having encumbered that first expense. So you have to have cash on hand, multiple months cash on hand, in order to just have a state contract. And that's not the reality for a large portion of nonprofits.
Okay, so if you have 90 days worth of invoices and you're remitting all that in just in one chunk, right? So you're doing it quarterly.
If you're doing it quarterly.
Yeah. So you're invoicing quarterly, but the statute requires a 30-day timeline, right? So that falls to the age of the earliest bucket of work or the oldest. You see what I'm saying? Like I'm trying to understand where you're setting the benchmark of the remittance from the 30.
So the 30-day as it's currently written is from the point of invoice submission. So, you know, so you can kind of push that timeline out a little bit further, right? So if I'm closing the quarter on my books and this is true for any business, right? You can't close the books on the first because you've got accruals to account for, you've got other things that have come in. So let's say you finish your internal accounting and you're ready to invoice by the middle of the month, right? We are actually so it's good timing, right? We're mid-April. We're submitting invoices for a number of our federal grants and our state grants right now. So once we've submitted that, the 30-day window starts. And so we would then theoretically, if we invoice today, we should be receiving payment by the middle of May. And that's for expenses that we incurred starting on January 1st. So you can kind of see how the timeline starts to get stretched out. And I think what we're really looking for, what I like about this, the idea of this work group and working through a lot of this stuff is what is a reasonable path for an organization that's a trusted organization that's been doing work with the state for years to not only exist in a reimbursement space, right? How is that many of us, when we pay contracts, right, we're doing a CRM software upgrade. We paid our consultant, we had to pay them half the money up front. Well, that makes sense. They've got to pay their staff starting on day one to do that work.
No. I understand that. No, and I come from an industry of rolling invoices and payment cycles and whatnot. So I understand what you're talking about with the timelines and cash flow and the payroll. I absolutely empathize with that. Let me just see. So if you were when you're submitting the reimbursement requests at the end of the quarter, have you experienced issues with them getting kicked back for refined information, incorrect fields, et cetera, et cetera? Can you talk to us about that?
Yeah, so I serve on the board of United Ways of Vermont, which runs Vermont 211. And that's been a common issue that we've experienced with Vermont 211, where invoices submitted, there's a dispute about a number or a clerical error. It gets kicked back, fixed, sent back, 30-day window restarts. And so then you're 30 on 30 on 30, and they can push it back and keep kicking it back as much as they'd like, and restarting that window so that they're still within the window. And I think part of that is I want to just say, I think it's important that we think about anytime we're asking the state to be a grantor and to fund this work, the state also needs to have the right resources in the right places in order to administer these programs. So in some places, it's not just about the rules, it's about how much resource do we have in grants administration at the state level, right? You'll I'm sure hear that from the administration around, well, we don't have, it takes a long time because it's all got to get processed. I know there was an issue at the beginning of the year, right, with Ledge Council, right? There's just not enough people. So when you don't have the resources to kind of process the different things, it's grant making is not simply pushing a button and putting money out. And so there needs to be resource on that end of things too. And so if there's a backlog and then it gets kicked back and then it gets kicked back over, and now you're further delaying and further piling up and further backlogging. And I think it's time that we have a real conversation about what are the resources that the state needs and the administration needs in order to effectively execute these things, and what is the parameters and guidelines for nonprofits to have so that they can have reasonable expectation of payment and reasonable expectation of contract, so that they can do their work in a reasonable fashion.
Any questions from the table? Rep. Nugent?
This might not be the right question for you, Jesse, but I'm assuming just with your roles in the past too, you probably have a good sense. As far as like a 30-day turnaround time for paying an invoice, is that a normal turnaround time? Like I know, like when we pay our vendors, it's usually 2 weeks. That's what the expectation is. So I'm just like, and is that something the state could change potentially?
Net 30 is a pretty consistent invoicing benchmark, I think, across multiple sectors from what I've seen. So for-profits that we partner with, other nonprofits that we partner with. We invoice Net30 for most of our fee for service work. And so that's a reasonable piece. I think, some of the complication is in the, the kickback of, if it gets corrected and then, you've kind of further extending that timeline. Net 15, I have seen on some invoices recently, in other areas. I think it, probably depends too on whether or not you've paid contractually upfront. Anything, if you've got a deposit down, and you're working off of that before you're kind of seeing that first invoice, you're more likely to see a longer invoice timeline on the back end.
I have a follow-up from something before where you were talking about starting the work before the grant contract was finalized. How common is that?
Very, very common.
And
That's a lot
so
of
you're just
organizations are forced into doing that because your grant year starts and I don't say this to say like I don't understand the position oftentimes the state or others are in, in these situations, right? You all pass a budget in, well, you hope to pass it in May, I'm sure. Oftentimes we're going into June. And then you got to scramble to get everything ready for July 1. And if there's new contracts or things, that's a lot of work, right? That's a lot of work. Sometimes if it's related to federally funded grants, there's an even longer lead time because you've got things trickling through multiple layers. But in particular with fully state funded grants, I think that it is relatively common that the office gets backed, the contract office gets backed up, legal gets backed up. There's not enough resource there to handle the volume. That's gotten better. I would say it's gotten better. It was obviously particularly bad, I think, during COVID. And with the largesse that we had in terms of ARPA funds and CARES Act funding that was flowing, that created, I think, additional delays. But from my, anecdotally, I've seen a significant amount of organizations have talked to us about and partners that I've talked to about this issue have said, yep, we've got to, you want to do the work, you got to get the work going, right? We got to, that shelter's got to be open. We got to keep moving. We've got to be able to provide that food. And so, that's done out of an incredible amount of trust, right? That grant contract's going to get executed. And oftentimes I think it's done at, nonprofits have this, sometimes just we're so mission focused. We're so about, making sure that our community needs are met that sometimes we're not, we're like, okay, we just got to push forward and trust that this is going to happen or the contract's going to be what it needs to be. But that can further delay things. One idea might be to think about, and again, this is something that could either get worked into the bill or could get worked through the work group and why it's important. Okay, we're going to kick back a correction to an invoice. Well, what if it's then net 15 after that? Theoretically, you've already done half the work, at least half the work. Could we shorten that time frame and just start to shrink things up? Again, finding clear pathways to do some advanced funding, a clear pathway to make sure that you're getting the appropriate indirect rate so that you have your staff have those resources. These are really critical things that, again, could make the same dollar go twice as far in terms of its community impact.
So the grants that you're taking on were the contract, are those re-upping contracts typically? Like, are you trying to roll something you're already confidently executing and you have a better sense that it is going to get renewed? Or are these fresh ones that you're just kind of doing the work, hoping you hit it, or both?
I've experienced both here, and I think other nonprofits have experienced both. So if it's an ongoing operation and something that you've received funding for in the past, yeah, you'll probably feel a lot more comfortable moving forward, prior to execution. We just got a great, letter as one of the 4 LPOs that, DSU is going to continue to fund that work, because they know the funding's there, right? Which is not, it's an enviable position to be in. They renewed us for another 3 years, so we know that's coming. Have we, we haven't, right? We won't have received the new grant agreement yet because they can't do that until you all have set the dollar amounts, in those funds. But they can tell us that we're going to get, resourced to continue doing that work. And And that's, you know, that's the benefit of being here in Vermont is we have those relationships. We have great partners in state administration, great partners in the nonprofit sector and the business sector to do this work. So it's both. And, you know, and sometimes it's, okay, we've got this new grant that's come down and we're waiting. And I think, you know, there's no getting around the fact that, you know, if it's federal, there's going to be other delays on the federal side, but we really have to look at what we can control and what's going to work for us here in Vermont. And that's important.
The bulletin itself, the directives within that, I mean, do you see ways that could be refined better to like offer more clarity to this process?
I mean, I think as written, there's some just really good pieces and again, things that we've been talking to the administration and to other nonprofits about. And I know the committee has for some time. And so some of the kind of the big pieces that are in there, like, you know, clear process around indirect rate that needs to be spelled out in the bulletin. The movement that the federal government made last year and the state has adhered to and followed this year, you know, has around 15% indirect is really helpful as a de minimis. But that's not a true reflection of what that is, you know, what that looks like. You know, they're already, you know, kind of required to do 30, but having some sort of recourse for when it's not, and a way to actually accurately capture how often that's happening and where that's happening and putting the responsibility in there. And you know, simplifying things. You know, the bulletin's so long, like, you know, how much can we do? You know, we tend to, and I've worked in government too, we tend to be additive, right? We build on top of the thing, instead of kind of trying to narrow things down. And so thinking about, and maybe it's something the working group could do as well, but really look at how do we streamline things and make it clearer, and what info should be included as in the grant agreements, in terms of that you will be paid. This is the, you know, the clarity around these different things I think would be important to flush through. And I'll just add, you know, one of the big things that's not in the bulletins that we do obviously need to talk about at some point, and that's where I think really making this where the working group and continued kind of collaborative work, multi-sector work needs to happen here is around funding levels, and how year to year nonprofits are facing a larger and larger gap in terms of what's expected of them in terms of the funding that's being provided and what the reality is in terms of what they can do. You know, pay for staff, you know, we might not be able to afford to keep up. Well, then we need to adjust our expectations in terms of what we can do, because the pay, the cost of services, inflation obviously is significant. And, you know, what we're seeing across the board is, you know, lack of healthcare benefits, no COLAs, you know, intimately involved in the issues around healthcare costs in the state as well. And that's a real burden on the sector. As those things grow, it's really eating into people's take home. And that's just creating another working class that's not able to be successful in the community. So, and we're losing great workers, great employees. A year ago, I lost 3 employees. They all moved because we don't have housing and in this state, and the healthcare costs are too high. And that's a story we hear over and over again. It's not just a for-profit sector issue. It's a nonprofit issue as well. And so we do need to have some conversation about level of pay as well, and building that into contracts and expectations, both from the administration and the legislature and the community in terms of what services and resources we can provide.
Anything else from the table?
Oh.
All right. Well, we really appreciate your time, sir. And we're going to start honing this in a little bit. So we appreciate your time, and we'll reach out if we need any more insight from you.
Wonderful. I really appreciate your attention on this. It's a critically important issue for a lot of Vermonters. And so I really, really appreciate your focus on it and your group's work here. And appreciate the time. Thank you.
Thank you. Um, a little bit more testimony coming in. This one tomorrow. We have some other entities coming in on a different bill, but I don't have opinions on this bill, so maybe we could touch base with them as well while they're in. But we're at right now. I guess we'll just call it a little early for lunch. There's no shortage of emails and other things for everyone to do, so we'll call the last 45 minutes of the